Welcome to Pregnancy Planets. If you're expecting or just curious about the amazing journey of pregnancy, you're in the right place. In this video, we're going to walk through every week of pregnancy, from week 1 all the way to week 40. Learn exactly what symptoms to expect, how your body changes, and what your growing baby is doing inside you. Whether you're a first-time mom or simply want a deeper understanding of this miraculous process, stick around till the end. Let's begin your week-by-week pregnancy journey. Weeks 1 to 4, conception and implantation. Pregnancy officially starts on the first day of your last menstrual period. In weeks 1 and 2, you aren't technically pregnant yet, but your body is preparing to ovulate. Around week 2, ovulation occurs, and if sperm meets egg, fertilization happens. This is conception. By week 3, the fertilized egg travels down the fallopian tube and starts dividing rapidly. When it reaches the uterus, into the lining. This marks the beginning of pregnancy. You may feel mild cramping, notice a slight drop of implantation bleeding, or feel nothing at all. Week 4 is when early hormonal changes begin. HCG, human chorionic gonadotropin, is produced, which is what pregnancy tests detect. You may start to feel subtle symptoms like fatigue, bloating, or even mood swings. Weeks 5 to 8. Early symptoms appear by week 5. Many women begin to suspect they might be pregnant. The most obvious sign is a missed period. You might feel more tired than usual. Morning sickness can start now, which includes nausea and vomiting. Though it doesn't only happen in the morning, other signs include tender or swollen breasts, frequent urination, and food aversions. Some women notice a heightened sense of smell or metallic taste in the mouth. Hormones are surging, and your body is adjusting rapidly. Week 6 intensifies these symptoms. Fatigue might feel overwhelming, and emotions may be up and down. In week 7, your uterus is growing, and your baby is developing at lightning speed. You may experience more vivid dreams, or find yourself craving certain foods. By week 8, your pregnancy is well established. Your baby's tiny organs are forming, and your body is working 24/7. Be gentle with yourself, rest when you can, and stay hydrated. Weeks 9 to 12, end of first trimester. Entering weeks 9 to 12, your baby starts to look more human. Fingernails and hair follicles begin to develop. While morning sickness might still be strong, you may notice some symptoms start to level off. Week 10 is often when many women go for their first ultrasound, a magical moment where you may hear your baby's heartbeat. Emotional connection begins to deepen. You might also notice some bloating and constipation as progesterone slows digestion. By week 11, many moms feel a little relief, though hormonal headaches and lightheadedness can occur. You might gain a small amount of weight now. Your uterus is the size of a grapefruit and slowly rising out of your pelvis. Week 12 marks the end of the first trimester. The risk of miscarriage drops significantly, and many women start to share their good news. Energy might slowly return, and morning sickness may begin to fade. Weeks 13 to 20, second trimester begins. Weeks 13 to 20 bring relief for many. This is considered the golden period of pregnancy. Your bump becomes more visible, and you may feel more like yourself again. By week 14, your baby can move. And though you won't feel it just yet, things are busy inside your womb. You might get a boost of libido or feel increased appetite. Around week 16, some women feel their baby's first flutters, called quickening. It feels like gas bubbles or butterflies in your stomach. Breasts continue growing, and skin changes like the dark line on your belly, linea nigra, may appear. Week 18 to 20 is when anatomy scans happen. You can find out your baby's sex if you wish. You may also notice round ligament pain as your belly stretches. Heartburn and indigestion might begin, so smaller meals help. Weeks 21 to 28. Growth and movement. Now, you're well into the second trimester, and your baby is growing fast. Movements become stronger and more frequent. You may even see your belly move from the outside. Week 22 may bring back aches and leg cramps. Sleeping becomes trickier, so try supporting your belly and knees with a pregnancy pillow. Skin may itch as it stretches, so stay at. By week 24, you may be taking a glucose test to screen for gestational diabetes. Your baby is practicing breathing and has a regular sleep-wake cycle. You may feel more emotionally connected as your baby responds to sound and touch. Week 27 or 28 ends the second trimester. Your belly is larger, your breasts may leak colostrum, and you could feel breathless with physical effort. You're doing amazing. Weeks 29 to 36. Preparing for birth. Now, you're in the third trimester. Baby is gaining weight and taking up more space. You might feel pressure on your bladder, making bathroom trips more frequent. And week 30, back pain and swelling in feet or ankles may occur. Shortness of breath is common, and your belly button might pop out. Week 32 to 34 may bring Braxton Hicks contractions. These are practice contractions, and they're normal. Sleep becomes more difficult, and vivid dreams may return. By week 35, nesting instincts hit hard. You'll feel a strong urge to clean, organize, and prepare. Baby drops lower in the pelvis, called lightning, especially for first-time moms. Weeks 37 to 40, final countdown. You're almost there. Weeks 37 to 40 are considered full term. Your baby could arrive at any moment. Watch for signs of labor, regular contractions, water breaking, and back pain. Your doctor will likely check for cervical dilation and effacement. You may lose your mucus plug, have a bloody show, or experience nesting. Week 40 arrives, and if your baby isn't here yet, don't worry. Many pregnancies go a little over. Stay calm, rest, and follow your birth plan. Pregnancy is a beautiful, emotional, and powerful journey. Thank you for joining us on this week-by-week look into the changes your body and baby experience. If you found this video helpful, please like, subscribe, and share it with a fellow mom-to-be. And don't forget to leave a comment sharing which week you're on. We'd love to hear from you. Until next time, stay healthy and take care. This is Pregnancy Planets, your guide through motherhood.